The alphabet soup of anesthesia in medicine these days, it's very difficult for a clinician whose sole purpose right now, and they're probably the reason they became a clinician in the first place, was to take care of the patients. Operationally, it's very difficult for an anesthesiologist or any other anesthesia provider to remain current on the ever-changing and ever-evolving, I should say, nature of all the different programs that are being instilled upon them. Whether it's PQRS or the new QCDR, or in the future it's going to be something called MIPS, and how you report on it is QRURs. There's all these different acronyms that most anesthesia providers don't have the time to really appreciate the full breadth of what that means. In collaboration with my colleagues, we translate what all these governmental programs say into meaningful operational achievements. And I do that through some of our technologies and make sure that whatever these governmental programs require, we translate that into an operational model that anesthesia providers can do seamlessly and not really know that they're participating, since it doesn't impact their operation. First Anesthesia, which is our backbone system, really is designed to try to take the information that is collected from a site, whether it is from an EMR or just a paper record, and convert that information into a claim that goes to the private payer or to CMS. That claim is what really drives and is what's fueling how these anesthesia practices work. It's very critical that the data that we collect from those sites is converted into a claim, and then it is then tracked as it gets reimbursed. While this is all something that could be done by hand, for the amount of clients and the sophistication that our clients expect of anesthesia business consultants, we have a very sophisticated tool to match that called First Anesthesia. First Analytics is designed to transform the single data points that may be collected during a case, whether it's clinical, administrative, operational, and convert that data into interesting information and strategic information that a practice can utilize to make strong decisions about their future and their current operational state. It's important that a practice always understands where they currently are, where they were, but that kind of information allows them to know where they should be going. We want to know, based on common language that all practices may want to look at, such as how many days are my bills in AR, what's my productivity for certain ORs or certain types of cases. We look at a practice to try to give them unique and real-time insights into how their operation and how the practice is working. We have specific dashboards on KPIs. We also have specific dashboards on monitoring their accounts receivables. But we have designed these dashboards to be quick, easy, intuitive, so that anybody can review them who has access, whether they are a clinician or whether they're an administrator. But these KPIs can really serve as the foundation for meetings with their facilities. They can serve as foundations for their own meetings, but they can be that benchmark. First Client is one of the mechanisms that they can bring all these different systems together under one roof, whether it's the reporting First Analytics program, whether it's access to First Anesthesia, the billing program, or any other number of applications they may work with. One of the examples of that would be with our sister company, Plexus Technology Group, and the product Anesthesia Touch. Anesthesia Touch is an electronic medical record uniquely suited and designed especially for anesthesiologists to bring with them on an iPad or in a normal PC to take care of the patients within the operating room, to ensure compliance, to ensure their documentation needs at any given point. That information is automatically transferred to anesthesia business consultants on our First Anesthesia platform. All the data is always aligned and is always available to them for reporting or any other needs that they may have.